forever. So. Hello, welcome to Compression Care's 5th Spotlight Educational Meeting of 2025. We'll be having these throughout the year, so please watch your email, check the schedule or look at our website, compressioncare.com, to check out the full schedule. Before we get into Andrea and Natalie's presentation, I want to tell you a little bit more about Compression Care and our sister company, Pretty in Pink Boutique. We're based in Nashville, Tennessee. We've been in business of helping patients with their compression needs and billing for garments for over 20 years now. Compression Care is the national vision of the owner and founder, Pamela Ludwig. Pam started Pretty in Pink Boutique and Compression Care with the goal of helping patients get the care they need while never paying more than they have to. At Compression Care, we strive to improve patients' lives by making high-quality care accessible, affordable, and convenient no matter where they live. An exciting new development, for those of you who have not heard yet, we have been using technology to try to help make the patients' lives easier and the therapists' lives easier. And our therapist portal has now launched. So this portal is available automatically to any therapist who has sent us a referral. And from that portal, you'll be able to see all the patients you've sent to us and the status of their order in real time. So it's a really neat help. You'll also be able to use that portal to directly communicate with the case manager who is working on your patient. And we're going to be making updates and upgrades and everything to this site as we go through the next few months here. So any new referrals, questions can be emailed to referrals@compressioncare.com or fax to 615-807-3334. A little bit of housekeeping before I get into the introductions here. But if you have any questions, please post them in the chat, and we'll make sure that we get to those at the end of the presentation here. But today, we're very excited to have Andrea and Natalie on our call today. Natalie qualified as a registered nurse in 2005 after 13 years working as a healthcare assistant and developed a specialist interest in the management of lymphedema as a community nurse, where she trained in the Castley-Smith method of MLD. She went on to work for a specialist lymphedema clinic in 2009, where she developed her skills and passion for treating patients with lymphedema and delivering training to individuals with specialist interest in lymphedema management, furthering her own development, becoming trained in the Ludic method of MLD. And I'm sorry if I got the Ludic wrong there, but Natalie became a member of the team at Haddenham Healthcare in 2012, where she took on a role as clinical advisor, becoming clinical manager in 2016 and completing her Master in Science in Lymphedema Care during that same year. Natalie now oversees all aspects of clinical training, publications, and research, as well as presenting at conferences globally and right here with us too. So thank you. Natalie was a trustee for the British Lymphology Society from 2015 to 2018 and is currently a senior member of the training team at the Lymphedema Training Academy. She is FGMLD trained and continues her clinical practice as privately as clinical director of lymphatic therapy solutions and clinical nurse specialist at Oxford Lymphedema Practice.
Well done.
Stuff. This is going to be exciting. After earning her degrees in English writing and French language, Andrea moved south to pursue graduate work in behavioral therapy, focusing on school counseling. During that time, she began her journey in health and medical as bilingual and French customer service specialist for Essity. As you know, Essity is Jobst, for those of you maybe use both those names. Her passion for education and counseling found its perfect match as her role ultimately evolved to medical advisor, primarily specializing in garments for lymphedema. After nearly 8 years of working with a variety of compression garments, a variety of clinicians, and a variety of patients, Andrea embraced the opportunity to join Haddenham LLC. She currently works as the operations manager, and she is looking forward to growing with Haddenham family as they bring compression resources to the USA. So, with all that said, I have worked with Andrea for years. I think she is a wonderful person, and I'm really excited to hear everything that they have to say today. So, without further ado, I will let Andrea and Natalie take over.
All right, thank you. Great. Thank you so much, Joshua. So, as he mentioned, my name is Andrea Rollison, and I'm the operations manager for Haddenham LLC. It's an entity of the UK-based compression company, Haddenham Healthcare. So, first, I want to thank Joshua for the opportunity to present. It's a great opportunity to be on one of the monthly webinars, and I just want to thank everyone who registered, whether you're joining now or watching this later. We know how busy your schedules get, and we really do appreciate your time. Towards the end of this presentation, there will be a QR code you can scan to provide your information to us. So if you don't have a sample of a product you see today and you want one, or if you need more information from us, you need occasional updates, conferences we attend, just know that that QR code is at the end of the presentation. And then I'm just going to give a quick thanks to Natalie, who's going to be doing the majority of the presentation today. She is the UK Senior Clinical Manager, so she'll be sharing some fantastic case studies. Before jumping into that, I'm just going to briefly review our agenda, a little bit about Haddenham, and then I'll hand it over to her. So today, we'll do a little intro on the company, and then Natalie will look into that product focus. She's going to talk about Easy Wrap, about Comfy Wave. She'll dive into some case studies for you to showcase how they stand alone, how they work together. And then towards the end, we'll get into how you can order from us and kind of questions you may have. So just a little history on Haddenham. As it stands, we specialize in the treatment of lymphedema, chronic edema, wound care. Our focus really is providing problem-solving solutions. That way we can support our therapists as they treat their patients, make sure that they're getting compliance, making sure they're seeing efficacy. And I just want to give you a little bit of background on the company. It was founded in the late 90s. It began with Andrew Wright in England, which is why it's called Haddenham. They began with hospital products distribution, but as they developed, so did a passion for wound care and lymphedema. By 2010, they were able to open up an Australian headquarters. In 2017, they released their own UK patented Velcro compression wraps. So Natalie will talk about those in a little bit. In 2019, we released Comfy Wave, which she'll also talk about. And that's a nighttime garment product line. So both of these did so well. And I mean, even despite the challenges of a pandemic, they really cemented the demand for Haddenham coming to the US. So here I am. They went ahead and started a US headquarters, and we opened to the public in July last year. So we're really excited to be here. Right now, we're a small team of 4, working pretty hard to, have outreach opportunities like this one, like this webinar. It's really great. And with that, I'm going to introduce Natalie, our Senior Clinical Manager. I'm really excited that she'll be able to share the case studies with you today and sharing her clinical expertise. So take it away, Natalie.
Thank you, Andrea. I echo everything you've said in terms of thank you to everybody that's registered. I'm a little bit nervous being all the way over here in the UK, but I hope that what I've got to say you'll find useful. I have, as Joshua said, been involved in lymphedema for many years, and being as a member of the team at Haddenham, it's been such a joy to be able to be involved in the development of products and sharing ideas with research and development from a clinical perspective. And I think that's one thing that we really stand out really well in that we innovate, and we innovate because we listen to all of you. So if ever you've got any feedback, do give it to Andrea, because she will be straight on a Teams or something to us in the UK to really feedback anything that you want to feedback. So the purpose of today really is to really talk to you about some of the products that we've got available over there for you in the USA. And I'm going to start off with Comfy Wave. Now, I was quite perplexed when I first saw Comfy Wave many years ago. And it wasn't until I put it on that I realised that actually this garment is nothing like a compression garment that I'd ever used in clinical practice. And it's, as much as it's classified as a night garment, it's really so different to anything that's out there. So yeah, I'm going to just take you through that. Initially, it was, can I have the next slide? Sorry. Oh yeah, it's there. I swore I wouldn't say that one. Thank you. So initially it was aimed at the nighttime garment market, ready for something that's quite comfortable for patients to sleep in. And we all know that there's a case for 24-hour compression. I think there's sort of mixed views on it, but we know that as much as when we are sleeping and resting, our edema may go down a little bit, but it doesn't stop overnight. And many patients were sleeping in traditional compression garments, which are really not best suited to being worn in bed. So Comfy Wave really allows us to continue that compression therapy overnight with quite comfortable garment, because it has soft and breathable fabric that means that it's quite gentle compression while you're sleeping. So we started off using it at night time, but then very quickly realised that we could be using it in the daytime. And it was because patients were wearing it and decided that when they were at home, that they would keep it on a little bit longer in the day. And as much as it is classed as a low compression garment, the way that it is engineered and manufactured means that actually it gives quite a firm compression. And this is because it's got low resistant yarns, and the low resistance yarns allow them to be put on and taken off quite easily, which is good for relaxation, but it still maintains that compression. It's also really breathable, and it's suitable for all year round. So it is very quite good. It's quite cool to wear than conventional hosiery, and I can vouch for that because I take them to the Caribbean when I go on holiday. It comes in many different body parts. So we started off originally with the arms and the legs, and then very quickly moved on to abdominal and breast bands. Then came the things like the gloves and the toe caps and the neck garment. But as you get to know the products, what you'll realise is there's a slight difference between the material in the toe cap and the gloves. And this is because the garment itself is a whole knitted garment. So it's not knitted on a flatbed machine and then sewn together like traditional garments. It's knitted whole. And it can be seem to be quite thick. So the toe caps and the gloves tend to be a little bit thinner because you can't have a thick fabric that sits around small digits. So it does seem a little bit thinner. You can see here on this image here that our model is demonstrating the ease of putting it on. This lady has lymphedema. She has lymphedema and has had it for many years and absolutely swears by wearing her Comfy Wave. So because it's easy to get on and off, it makes it better for those that have trouble with dexterity in their hands or struggle to get garments on and off. I've found lots of, even the people that you think are not going to manage with compression will tend to manage with a Comfy Wave. Hence why it is being used in the day, because there are instances where nothing else is really suitable to get on and off. It is made from soft, undyed cotton. So it has soft cotton against the skin. And as I've said, it's got a seamless design, which ensures maximum comfort. It has a wave patterning, and you'll see throughout some of the images later on in the presentation that this wave patterning that will create sort of a pressure differential on the skin, which helps to move fluid out of the skin to areas where it can drain. The wave pattern itself as well gives this high air permeability, which means that it maintains its coolness and it maintains its stretch. Now we're on to Easy Wrap, and I want to talk to you about Easy Wrap, and then I'm going to talk to you about how we're using them in clinical practice. So Easy Wrap itself is an adjustable compression wrap system. It was developed in about 2015, 2016, and it consists of 4 pieces for the leg and 2 pieces for the arm. Now, you might sit there, and it comes with liners, and there's different support bands to allow you to add localized compression at certain areas. For example, with the support bands, we will use them if we've got patients that have got large overhanging, massive localized lymphodemas. We'll pop the wrap on and then pop a support band on top of that to really give us more of a lift and increase that pressure over that area. It allows us to work with the theories of Laplace's law, and you'll see that actually the wrap system itself, have the slides gone?
I don't know what just happened, and I apologize. I'm going to try to figure out what happened here.
Okay.
Because they just disappeared. I'm so sorry. Well, while I'm trying to figure this out, I'll just mention something. Okay. I'll just mention something about the Comfy Wave while I'm trying to figure out what just happened to the slides.
Josh has gone.
That's a cliffhanger. He's gone.
I can carry on talking, but it might
you know.
There you are. There you are.
I apologize. The button I hit was not the right one. I'll tell you that.
The joys. I was saying how good it is to have technology.
It's technology, and I'm really sorry.
No, it's fine.
But they have disappeared. But what I was going to say here is that I really don't know what happened to it. Let's see if I can go out of here and back over to here. No, they're gone. So sorry. What I was going to say, though, just to let you know, Stephen, if you could help out here, I'd appreciate it, because they just disappeared. And it says I have no slides. But just, well, I know he's working on that. So
there we go.
I know
we're on slide 12.
Yeah. Get back up there.
There we go.
The Comfy Wave, just so I can finish my thought now that we are back up. Thank you, Stephen, for fixing that. The Comfy Wave product, I was actually shipped a sample, and I put it on my leg. And about an hour in, I took it off and took a picture of my leg and sent it over to Pam, the owner of Pretty in Pink Boutique and Compression Care. And I just sent her a picture of my leg and said, "Look what this garment just did." And she was like, "Oh my word, I've got to get one for my arm." And so she got an arm, and now she wears that is her garment that she really loves it, and even had Andrea out to work at the PIPB location. So it did make it did exactly what you just said it was going to do, and really left the lines on my leg to show that it was having that wave effect, and it worked so well that Pam was in just by a picture. Pam went, "Oh my word, I got to look at this." So
that's brilliant. That's
brilliant.
So
sorry about the slide disturbance there.
That's okay. I'll try and get back into swing. Anyway, Yeah, so you probably sit there and everybody that's watching and think, oh, it's another adjustable compression wrap. And there are a lot of compression wraps out there, but knowing what we know and having sort of worked with compression wrap systems for at least 15 years, we were very much looking at, okay, how can we make them better? What was wrong with the other wraps we used, and what can we make better with when developing Easy Wrap? So we considered Laplace's law and considered the theory of bandaging as well, to think about, okay, well, we know that if you have a bandage and you bandage with a 50% overlap, that actually and you use different size bandages, you can achieve graduated compression. So we developed the wrap. I say we, I'm not the brains behind this at all, but it's the royal we. We developed it so that it comes in 4 separate pieces, so that you have a foot piece and then your leg piece will overlap your foot piece to ensure that you've got that graduation and that you are not going to push edema back down into the foot. Then you can either combine it then with a knee piece and a thigh piece as well. So you bring it all the way up to the top of the leg, as well with the ad bands or the support bands. The support bands can come in quite large sizes. So there's often times where we will anchor a support band to the thigh and then take it around the body to create a hip spiker, like we would do if we were bandaging and somebody got edema right up into their hip. So they are designed to be used together or individually, and we will quite often use them in combination with other products such as compression hosiery and Comfy Wave. Have we gone? Oh, can we go back one? Sorry, that's it. It comes in 2 compression classes. So Easy Wrap Strong is a 30 to 40 millimeter of mercury. Again, you can see from this image here that it's quite a thin fabric that is very similar to and has a similar stretch to the traditional short stretch bandages. And we've done lots of testing to look at the static stiffness and its performance. And it's proven to be really quite well. There's lots of case studies out there as well showing how it can reduce swelling and improve wound healing. Easy Wrap Light is slightly more stretchy, which we use for more mild to moderate compression needs and palliative care. You can see here it's low profile in design, and Andrea and I were chatting the other day, weren't we, about, it was only yesterday, wasn't it?
It was.
Do you want to say what?
Oh, yeah, sure. I went to an extreme hip hop step class and stepped my way into a rolled ankle. And as soon as I got home, I took my shoe off and I was like, all right, I have all the goods. So I put my Comfy Wave garment on, and then I put the Easy Wrap on top of that for the foot portion. And then the next morning, getting ready for work, I wore just the Easy Wrap. But I was really impressed with the way that it fit right into my shoe. And for anyone who knows it, I just wear a Birkenstock. It's like a tennis shoe type. So it's not anything that's like super roomy. But I was really impressed. I went to work and I was like, look, they really do fit in shoes.
Yeah.
And it wasn't even noticeable. Everyone was like, what are you talking about? Oh my gosh, you have that on. And my ankle felt a lot better.
Brilliant. There's nothing like being able to demonstrate that you use them as well. So, and yeah, you can see on this image as well that the lady who wears Easy Wrap has got her shoe in, but she's also got sort of bell-bottom skinny jeans on with a whole leg Easy Wrap. So for her, she couldn't believe how actually she's managed to get her clothes on as well without the bulk. So when we're looking for something different than to a bandage, you think about, okay, bandaging, multi-layer, multi-component bandaging for us all is very, very time consuming. And we all know through the literature and through testing that very quickly, if edema reduces very quickly, that bandage slips. So if you don't change that bandage within a couple of hours of application, you can cause issues, or your edema might rebound slightly. So the lovely thing about Easy Wrap is the fact that actually, okay, as that edema starts to reduce, because of the stretch in the bands will come in a little bit to support that reduction. But then obviously, if there's a big reduction, it'll start to slip. So the patient can then just tighten it up themselves, and then they continue to gradually reduce themselves. So for me personally, I say personally, in my clinical practice, where I'm unable to do real intensive therapy on patients, I will ensure that they've got a toolbox of things and support them to decongest themselves. So I'm going to talk you through some case studies now. Case studies that a few are from my clinical practice, or those that have been published in some of the literature. So we use Easy Wrap as part of combined compression therapy and as part of modified decongestive treatment at home. Now, just go on to the next slide. That's it. Part of my role at Oxford Lymphedema Practice. Oxford Lymphedema Practice was set up by a group of surgeons to support patients with having lymphatic venous anastomosis. And in 2019, we started doing liposuction. So the healthcare system, as you probably are aware, is a little bit different over here in that we have a public funded service that patients can go and see, but it's quite sporadic and services are not consistent around the country. So often we get patients come and see us on a Tuesday for an assessment and to see if there's any suitability for any surgical options to manage their lymphedema. Now, this lady came to see us and she came to see us really quite distraught because her leg was getting quite big. Prior to seeing us, we'd invited her in for an ICG scan where the surgeons will inject indocyanine green, which binds to albumin in the tissues and is then taken up by the lymphatics, allowing us to image the lymphatics. But as well as that, she was always also sent for an MRI scan. So we combine the both to give us a full picture. The surgeons combine both. I just sit there and talk compression. They combine them both to give them a full picture of what's going on in terms of edema, what's fluid and what's fat, because you all know that the inflammatory process as lymphedema progresses causes the limb in itself to become a tissue. So here are her pictures. It's a busy slide, but I'll talk you through it. She was a young lady. She came to us with lymphedema secondary to gynecological cancer. She'd had a pelvic node removal. We did limb volume measurements, and at this point, she was at an 86% excess limb volume. Her current management was a flat knit class 3 thigh length garment, which when she put it back on, I was like, that really isn't a good fit because it was too easy to get on. And we know that if you're not, it's not tight enough. So it was too easy to get on. It was doing nothing but allowing her leg to grow. So she had the Dixon MRI sequencing to guide the decision making. And along with the ICG, which are the images on your right, will show that actually she got no linear lymphatics, which means that she wouldn't be suitable for any lymphatic reconstructive surgery. And then she got a mixed reticular pattern around her limb showing dermal backflow. And so she got quite an extensive lymphedema. When we compared that to the MRI, the MRI scan showed that she'd got much less fluid in her thigh. So there was 10% fluid in her thigh, but up to 70% of the limb volume in her calf was fluid. So she wanted to have liposuction. But we needed to see, right, how much decongestion can we get prior to planning for liposuction? So you can see there's lots of fat and fluid. So we sent her away, and 8 weeks later, I say send her away in easy wrap over her current class 3 garment during the day, and then easy wrap over her comfy wave at night. We rescanned her with her MRI scan to see how much fluid was left, and did her limb volume as well, and her limb volume had reduced by 30%, so she got down to a 57% excess. Still bits of fluid in there, but quite a lot of fat. And it showed that the fluid in her thigh had increased a little bit, which is interesting, because does that mean that she was not applying the wrap tight enough or readjusting it enough on the thigh, that it was sitting up in the thigh a little bit more? But she'd managed to reduce the lower leg down to 35%. So the remainder was fat. So she continued with that compression regime until she had surgery. And now she's got 2 legs that are pretty similar to each other. And she still has her comfy wave and her easy wrap, but because she's only 5 or 6 months post-surgery, she's still using the majority of her flat knit compression garments. So it's really positive, and I love the fact that we've managed to show using scans the reduction that you can actually achieve with it. What's also interesting, especially in those patients with lymphedema that are going for liposuction, is that the bigger the limb gets, the harder it is to try and manage that edema, because we get the compression on, and then you can actually end up, as much as you're pushing the fluid through the skin to get to an area where it can drain, we also push it deep. And sometimes when there's a big layer of fat around, the edema sits in the deep fascia layer. So once they've had liposuction, it makes that edema easier to manage. So that was her. I'm now going to talk you through a couple of more case studies, but what we will do is I'll tell you the patient history, what we did, and then we will present their results together afterwards. So this patient, again, another patient of mine, this was during COVID actually, and we were really restricted, as I'm sure you were, in what treatments we could offer. So again, it was very much about getting patients to self-decongest. This patient had bilateral inguinal hernia surgery age 6 and had complications following that. Always felt that something wasn't right in his leg, but didn't have an onset of edema until 6 years. So it's probably about 10 years now. But it was mainly located in the lower leg, but then progressed to the thigh. Again, they said that we're seeing more patients that have got inguinal node fibrosis or dysplasia noted, where they have longitudinal lymphatic channels, but the nodes aren't working. Again, ICG confirmed that it got clear linear channels, but it disappeared under dermal backflow into the groin. He'd not had any genetic testing for any possible phenotype for primary lymphedema, or query if it was secondary to the inguinal surgery. No effective lymphedema management, and had episodes of cellulitis. So his measurement data in clinic, I do several things where, first of all, I'll get the patients to fill in their limb qual, so their quality of life scores, so that I can really find out what's important to them. His main problem was his concerns that the edema will progress and stop him doing the things he loves. He was also considering having lymphovenous anastomosis. His limb volume measurements were done by manual tape measure in 4 centimetre increments, so the truncated cone method, and he had a 37% excess. Then I also very much use a lymph scanner, and at times will use the skin fibrometer in my clinical practice just to assess percentage water content, because as you saw with those MRI slides, edema is not consistent throughout the limb. So as much as I've got a 37% excess limb volume, I want to see where are the pockets of edema. So I mapped in with the lymph scanner as well, and we had a percentage water content of between 34 and 60%, whereas normal tends to be anything sort of between 25 and 40%. And then the induration of his tissues was higher in his affected leg than his unaffected leg. So yes, that's that bit. And then so we devised a treatment plan. His treatment regime, again, full leg easy wrap strong during the daytime. And then we combined the IPC machine with Comfy Wave, and then Comfy Wave and easy wrap at night. And this treatment plan was devised really based on what the patient could fit around work. He was sort of currently on a course at the time, so he was sat lots. So I was trying to get him to factor in time where he would promote movement and emptying the lymph nodes as well. We ordered garments prior to his pre-treatment visit, so I was able to demonstrate application and removal. And then we just did follow-ups on day 2, virtually, and video calls so that we can talk about what was happening with him. So it really just helped that him have that written sort of plan so that he could perform his own treatment. The next patient was a 63-year-old male. He'd had cancer treatment for prostate cancer, and he'd never really had any psychological supports sort of following his diagnosis. He was being monitored, post-surgery monitoring for any signs of his PSA. He'd had multiple LVAs, which resulted in leg softening, but he had got some lymphatic sclerosis. So it was sort of, there was no guarantee given that LVA would completely cure his lymphedema. He was using just custom-made circular class 2 garments in a one-leg panty. He was using deep oscillation at home, performed by his spouse, and that was causing huge issues for him because he felt that it had changed the relationship that him and his wife had, and she was becoming more of his carer. So he wanted to really be able to take control of his self-care so that they could reimagine their relationship. So his measurement data, he came in with an 18% excess limb volume. Again, he'd got a high percentage water content with his lymph scanner readings and his skin fibre meters, so the induration of his tissues were firmer in that affected leg. The things for him was he just really wanted to be able to go running and stay active, but his biggest outcome he wanted was to be able to just wear his skinny jeans with confidence. So his edema did extend into the hip. And yeah, so you can see that image there. Sorry, you're moving on. It's okay. I'm just making sure I've got what I need to say. So his treatment plan, we started with FGMLD, his current hosiery with a wrap in the daytime, repeat his MLD, and then Comfy Wave full leg easy wrap at night. He wanted to, he found the MLD, self MLD, quite difficult, and wanted to change what he was doing. So we ended up getting him an IPC machine. And again, he would use his Comfy Wave with the IPC machine and mix and match his garments. So then I saw both these patients at a 2-week follow-up. And you can see that actually both of them have had a limb volume reduction. So from nearly a litre each, both said that you could see that the leg felt softer, more movement, but still feels the thighs stubborn. So was changing his mode on his pump to continue with that. The other patient, again, found that they got a softer thigh, especially behind the knee, and more movement in the knee. The jeans weren't as tight, and it had a positive impact on his relationship with his spouse. So just in 2 weeks of changing up that treatment and getting them to increase compression and use different products really helped them to reduce their swelling.
Natalie, I just want to say before we move on to this slide, we do have a question.
Okay. Yeah.
So this was for the first one that we had with the ICG images. Why did you use the base of Flatnets and Easy Wrap? Was it the level of compression as seen with more traditional bandaging, or another reason?
So, sorry, Andrea, repeat that.
Yep. Why did you use the base of Flatnets and Easy Wrap?
It's because our clinic runs 1 day a week. So we've got, and the patients that come to see us, we've had patients that fly over to see us from America. So it's that we have to be able to give these patients the tools to be able to do as much as they can themselves. So this lady was from about 600 miles away. We run clinic once a week. No capacity. She got no capacity for her NHS service to be able to fit her in for bandaging because there's no money and everybody's really stretched with huge caseloads. So it's a case of she just really wanted to do something. So, and because I'd got into doing that in COVID and seen, yes, it takes longer than it would if you were to do a intensive bandaging, but it also gets the patients used to having high levels of 24-hour compression, especially if they're going for liposuction.
Okay, thank you.
I'm sorry, I'm not looking at questions because I can't.
That's all right. That's why I am.
Yeah, I'm glad you threw that one in there because it did relate to these case studies. So before we moved on, it was a good time to answer it.
That's great. That's great. Yeah, I don't multitask. I'll get distracted. We'd be off on a tangent. I'd be here for hours. So you can see here on these images, these are again just layering to increase compression and stiffness levels and make the application easier. So rather than opting for a bandage or a higher compression class of single layer, you can see if you sort of work it out that a comfy wave gives 18 to 21 millimeters of mercury and the Easy Wrap 30 to 40, you're up to about 60 something millimeters of mercury, which is up there with what we'd achieve with bandaging. Again, we will combine, if somebody's struggling, Easy Wrap over a class 2 garment as well. So it really is quite good to do that. Now, these images, again, just show some of the other applications. So you can see here we've got ICG imaging showing the comfy wave ridges, and it shows that pressure differential, what we see when the garment's been worn for a matter of minutes. But the image on the left is of a lady who'd gone and had a hip replacement. She'd had hip dysplasia in both hips and had surgery in her 20s. She's now in her 60s and has had to have a complex hip replacement. She'd had both done. So she'd had it first on her right hip, and she said that the actual swelling and the bruising was much worse on that hip, the after effects of that. But then when she had the second leg done, the left side, she was in comfy wave immediately, and she said that and we could see it, that the bruising and the swelling was far less using it post surgery. Again, we've got other incidences where people have applied it post surgery and it's really helped, and it helps with bruising. So that's really good. This, again, publication, this was a poster presentation done by one of the team at St. George's in London that was presented at the British Lymphology Society. This patient, due to the fatty nature of his tissues, decongestive therapy had failed. So he proceeded to have liposuction. Post liposuction, he still had an excess limb volume, and treatment was planned for self-care using a class 3 so 34 to 46 millimeters of mercury with Easy Wrap Strong over the top. After 3 months, he'd had a reduction noticed. Whilst there was still an excess in fluid, the patient was continuing to reduce. So, and he was still considering further liposuction to the thigh, but he'd had a big increase in his quality of life. So he had really continued to reduce himself using those treatment methods. Oh, this gentleman, lovely gentleman, he'd came to us. He was being treated at one of the clinics and was part of the patient group that were involved in the development of comfy wave neck. He agreed to come and have some ICG scanning, so just so we could have a good look at him with the comfy wave neck on. He'd had right base tongue squamous cell carcinoma. He'd had radiotherapy, chemotherapy. Those typical symptoms we see with our head and neck patients, such as the choking, reduced saliva, and his large amount of swelling that sat in his submental region that was pitting. His current treatment for his lymphedema, he was having photobiomodulation and LED therapy, MLD or SLD, doing his own SLD a few times a day. Compression, he was introduced to, as I say, compression during the first round of testing and now uses it as main compression, combined with simple lymphatic drainage and exercises only. We did measurements on him pre-use of comfy wave and then post comfy wave use after an hour, and we've had to take the video out because it wouldn't play. But we have got images that will be published at some point with showing the comfy wave. But you can clearly see that his tissues have gone from being really quite swollen, and we were unable to really pinch the skin, to actually an hour later, the comfy wave ridges are there, the swelling has softened, and his tissues are much looser. So that's good. And I'm very excited to announce that for the past 18 months, we've been working on comfy wave shorts. There's been several rounds of testing, and we've tested them on patients between the UK and Australia and have now signed off the final version of them. So we're hoping that you'll have those very, very soon, and they're brilliant, and I'm really excited.
That is awesome.
Thank you, Natalie.
That was okay.
They're fantastic. I feel like even in preparation for this, I still learn something every time I hear you talk about the cases. So I love that we're here and able to share.
For sure.
And so again, just this slide, here in the US, if you want any updates, if you need, we'll be sending out updates when the shorts are here and in stock. Conferences we'll be attending. If you need a sample, just go ahead and scan that QR code, and then you provide us your information. We'll be in touch so that way we can connect on all of that. We are here from 9 to 5, Monday through Friday. We are on the East Coast, so Eastern Standard Time. And then on the next slide, we thought, what better way to end than with a team photo? So I'll just go ahead and say from left to right, you have me in the tie-dye. Again, I'm Andrea. And then you have Tom Wright. He's the managing director for Haddenham. Molly is our customer service specialist. Natalie, the senior clinical manager who just gave this beautiful presentation today. Victor Luciano, he is the USA's general manager. And then Mike is our warehouse lead. So if you're reaching out to us, it's usually going to be one of us four. If it's something more clinical, we'll loop Natalie in when we need her. But that's our team right now.
Nice. Yeah. And I'll say this too, that I've worked with Molly as well, and she's absolutely awesome. So she answers things really quickly for us. I'm going to go back one slide and leave this QR code up so that other people can do this. And then I know that we've got a couple other little questions that I kind of wanted to run through real quick. with this material, one, it's totally different. So if anybody hasn't touched it, it looks, feels, everything is just different from what we are used to seeing. And so little questions like, how do I wash it comes up. What is the care and washing and care instructions?
Do you want me to, or you go? Andrea?
I'll go. You tell me if I'm wrong.
I've done enough talking.
I mean, the great thing about Comfy Wave is that it's made from cotton. We actually don't use elastane in this product, so you can put it in the washing machine. You can put it in the dryer. I typically say low to medium heat because everyone's dryer does something different. But you can air dry it, but if you need to put it in the machine, you can do that as well. It's safe to do that.
I'd say as well that, and it is a tip for using it, is that some people didn't realise you could put it in the dryer and found at times that it sort of goes a little bit loose. So we will say, right, tumble dry it, and it actually brings it back into its shape and gives it that resistance that it needs. So, like I suppose a woolly jumper might go a little bit baggy at times, and then you accidentally put it in a wash or a tumble dryer and shrink it. It's the same kind of thing. I regularly shrink jumpers.
Actually, you just made me think of one other thing too. If you have like a little laundry bag or something, maybe use that, just because any of those little black threads, you don't want to get caught if you have other things in there, like a hoodie with a zipper or something of that nature.
Yeah.
Gotcha. Yeah, that makes sense. Yeah, we typically tell people to wash all their garments in like a what I would call a lingerie bag or even a pillowcase, if that's the way it works. So just to kind of keep it safe.
And the same with Easy Wrap as well. We would say put Easy Wrap in a laundry bag. Make sure all the Velcro tabs are closed on it before you then pop it in the washing machine. Yeah. That can't be tumble dried. That has to be air dried. But definitely, and because you need to fold the Velcro back so that it maintains its stickiness.
Okay. So another question here, like how long does it take? And I know like with billing on our side, it takes time, right? We have to process the insurance, we have to communicate with the patient, we have to do that kind of thing. But once we are actually able to place that order, how long does it take for the patient to get their product?
Mm-hmm. Yeah, so it is a ready-to-wear product line, which means that we have the inventory in our warehouse, which is in Charlotte, North Carolina. So everything is happening out of Charlotte for us. So it depends on how long it takes for ground to deliver to your state. It could be anywhere from 2 to 7 days, depending on how far you are, but pretty quick. And we have expedited shipping options as well if you need them.
Awesome. Now, I noticed that you were talking a lot about the, the Comfy Wave and overlapping the wrap over it. What about overlapping pieces of the Comfy Wave garment? Is that something you can do as well?
Yeah. Yes, you can. You can. So, I mean, if you were to combine, say, the thigh high with the shorts, there'd be a slight overlap on it. Mm-hmm. So some of the products do overlap. We haven't had any issues with that. So until the shorts are available, we have patients that will wear 2 thigh length garments and an abdominal band over it. So that overlaps the thighs to just help that swelling that sits in their hips.
Okay. And then also you were doing you did the flat knit garment on the first patient that you talked about. You did the flat knit garment and you went over the top with the Easy Wrap.
Yes.
Right. Now on the if we're using a Comfy Wave product, would we want to do? Would you recommend overlapping another garment like that with a Comfy Wave, or even if it's not the whole garment, at least partial? Like if you had a capri and you wanted a knee-high Comfy Wave or something like that, would that be?
That'd be okay. That should be okay. Yes. Yeah. So you put the capri on first and then put the Comfy Wave on.
Okay.
below me. So you've got that overlap. The other interesting thing that I've only done this week as well, I had a lady who actually what worked for her was wearing a very light flat knit garment with her comfy wave on top.
Okay.
But I don't know how that impacts how the ridges affect the limb.
Right.
But it worked for her, and she was a lady that was in sort of her 80s, 90s, and that just worked for her. And again, I've had a lady this week who's struggling due to a shoulder injury. So I've said to post liposuction, really, they have to stay in flat knit garments. But I've said to her, okay, we will drop your compression level at night, but put your comfy wave on top of your flat knit garment just to give you that, so that she can get it on. She maintains that pressure and it doesn't really pull a shoulder out as it's trying to heal.
Right.
But saying that, it's that thing of it's this, we adapt the use. It's not written anywhere, and it's not something that from a company perspective we recommend, but when we talk clinically together, we all bounce off each other of, well, have you done this and have you done that? So
it definitely is different when you get into the clinical setting, like what we're actually doing in clinic varies a lot. So is there anyone else out there that might have another question? I know that we've had several, but I don't see anything new coming in now. So, but thank you, both of you, I know it's a totally different time for you, Natalie. So I really appreciate you hanging in there late and doing this. So, but thank you for coming on here and doing this. If anybody out there listening does have questions, they want more information, I know they can scan that to get on your mailing list. If you have my information and you want me to connect you, I will be happy to connect you to Andrea and get that done. But thank you for attending the series again. I appreciate the questions. I hope you all are as excited to try this out as we were when I got to put it on. We will have a recording of this. We'll make sure that it gets out to everybody. We will also be posting this on our website. It's very easy at compressioncare.com. There's a banner at the top of our website. You click that, you go right to all of our past presentations, and everything's on there. So if you do have any questions at all, please reach out to us, and I will make sure to get you in touch with Andrea and if needed, Natalie there. Thank you so much, both of you, for being on here and doing this. I really do appreciate it. I think you've given some great information.
Yeah, thank you for having us.
Thank
Absolutely.
you.
Anytime. Thanks so much. All right, you guys, good. All right.